Code Black, Opioids on the Suncoast is brought to you by CAN, Community AIDS Network.
Everyone, I'm Lyndon Blake. Welcome to Code Black, an SNN special report on the opioid crisis on the Suncoast. All month long, our reporters have been diving into the issue of the growing opioid epidemic, and tonight I'll be joined by members of our community who share their thoughts and experiences on the epidemic. But before we begin, it's important to understand what opioids are. They're drugs that act on the nervous system to relieve pain. They include heroin, fentanyl, and pain relievers like oxycodone, hydrocodone, codeine, and morphine. According to the National Institute on Drug Abuse, opioid pain relievers are usually safe to use for a short period of time, usually when prescribed by a doctor. But these drugs become misused. They produce euphoria, something addicts just can't get enough of. And this is a terrifying thought. Those addicted to the illegal drugs have no trouble finding them right here on the Suncoast. One of the reasons the Suncoast is ground zero when it comes to the opioid epidemic. SNN's Hallie Pilot shares further details.
Opioids are a narcotic that is in a family surrounding heroin.
Heroin only part of the problem.
Fentanyl and carfentanil have become the main players in the overdose epidemic.
The families, it destroys them. They lose their children. I don't think there's anything worse.
Families feeling the far-reaching agony.
More ODs, more deaths, more families that we can't reunite because they're just so lost to the addiction.
We just have had a large influx, and it's been steadily increasing over the past 3 years.
Why is it having this impact on the Suncoast?
We're working collectively with narcotics divisions and the Department of Drug Enforcement, the DEA, to try and solve that.
But they're dealing with an epidemic.
We're noticing increases well beyond 100%. From this exact point last year.
Responses in the double digits each day.
To either a heroin call, a heroin overdose, or an overdose death, that's when it starts to become an epidemic to me.
A crisis for both police and social services.
The cases are just pouring in.
Sometimes up to 5 of them in a week.
We look at the children involved, and how many cases of children are we seeing now that are removed from homes because of a heroin problem or an overdose or even an overdose death.
It's just heartbreaking. It affects the children, of course, too, because they can't understand why their parents won't just stop and straighten up.
Police are also trying to answer the question of why.
There's everything from it's easy to get, it's the best high I've ever had. I don't know how to get off of it.
So common that Thier said these calls have become routine.
I don't want to ever say that something has become second nature, but this no longer has shock value to us.
Robertson said about 85% of the cases they see are opioid related.
When they go into foster homes and there are other kids there tell them, your parents are never coming back, they're not going to get better.
The drugs tearing families of all kinds apart.
It's not subjected to one social class, it's not subjected to one race or one gender. It is across the spectrum.
At some point, they have to accept that reality. It becomes final. They really aren't coming back.
Reporting in Bradenton, Hallie Pilot, SNN, the Suncoast News Network.
And joining me now is Mike Harrell. He is an investigator with the Sarasota Police Narcotics Unit. Now, we were talking a little bit earlier how you used to be involved with helping shutting down pill mills around here.
That's correct. Before I came to the Sarasota Police Department, I was a narcotics detective with the Tampa Police Department, from which I retired. Last several years of my duty there, I was assigned to the DEA, and that was specifically on the Tactical Diversion Squad, and we dealt exclusively with the pill mill issues.
And one of the big concerns nowadays is you think you're buying a pill, but the ingredients you're not really aware of.
That's correct. I mean, we still have physicians out there who are prescribing opioids. Nothing like what we experienced during the heyday of the pill mills. But the problem is we are still seeing those being sold, but however, there's a new black market for pills, and these people are making these pills in their back bedroom, their garages, and nobody really knows what's in those. That's a growing concern.
And you grew up around here, you lived here for a while. Do you think the people here on the Suncoast realize really how bad the epidemic is?
I don't think so, and I say that because there was such a large media coverage over the pill mill issue, and when the Attorney General Pam Bondi got involved, and Florida used to be known as the Oxy Express. And when that came to an end, I think a lot of people thought that maybe the whole pill mill and opioid problem had gone away with it.
And you were telling me earlier, I mean, Manatee County has higher numbers statistically with opioid overdoses than here in Sarasota, but there's barely a border. People cross over into Sarasota on the North Trail, and it really is bad here in our backyard.
Yeah, when you think about it, if you drive the North Trail or you drive 301, other than looking up and seeing a green sign, there's no barrier between our communities. I mean, we are really one community.
And your mission here investigating these things, what would you like to see happen in the next couple years with this opioid crisis?
Well, we just recently got new state legislation this year, specifically dealing with fentanyl, giving it mandatory minimum prison sentences, and also allow somebody to be prosecuted for a death if they sell a product that causes a death. So obviously there are some enforcement tools, but it goes beyond enforcement. It really relies on a public education, public awareness, treatment, and counseling. I mean, that's going to play a big part in diminishing this problem from here on out.
And do law enforcement officials kind of have a counselor role when you see these overdose cases, when you come face to face with these addicts, and helping them get off the street and stop using these drugs?
Well, I think law enforcement does. I mean, when you think about law enforcement and the training and the academies, you have to be kind of an all-encompassing individual when you're in law enforcement. So can law enforcement maybe talk somebody down off a ledge, get them to put the gun down in a situation like that? That can happen. And you can talk to somebody on the scene of an overdose, but that's not long-term. And we'd like to think there may be some effect, positive effect from that, but you can't rely on law enforcement to continue the long-term treatment and counseling that these people obviously need.
Has the Sarasota Police Department kind of stepped up their efforts here locally in the city limits of Sarasota to, put opioids to a stop?
We have. I mean, our detectives are out there every day in the field looking for who's responsible for bringing this stuff here. Again, our detectives are buying opioid pills that are prescribed every day. They buy those. But again, a bigger problem could be these illicit pills that people are manufacturing in alleys, if you will, back rooms, garages, that they're kind of putting their own cocktail together and pressing them with pill presses that they can buy off the internet and selling those to people out there who think they may be getting an oxycodone or a Dilaudid when in fact they don't know what they're getting.
So you're saying that even though the pill mills have been slowed down drastically, that people are still able to produce mass pill selection in their home?
That's right. And again, while we do still see pills being sold by individuals who had them legally, lawfully prescribed by a physician, it's nothing like what we experienced in what was known as the pill mill days. What we're also seeing now is an increase, and everybody is aware of this by this point, the fentanyl, the analog carfentanil. That's a deadly substance, and it's not only deadly to the people who choose to use it at any particular time, but it's deadly to first responders and medical personnel, as we've seen here recently.
So the secondhand effects can be just as deadly?
That's correct. I mean, last week President Trump declared a national health emergency on the opioid crisis. And I think when you look at everybody that can potentially be affected in a negative way here, it's no longer just the person who's using or abusing and their families. But last week in Ohio, there were 3 emergency room nurses who, after dealing with somebody who was brought in from an overdose, collapsed and had to be revived with Narcan from a secondhand fentanyl exposure.
So people watching at home, if they see someone, whether it's on the street or walk in on someone in the house overdosing, what's the first thing they should do?
Obviously, call 911. They need immediate medical attention, and law enforcement arrives. Here in the city of Sarasota, we have a system in place that the first responding officers have a protocol to follow to try to get as much information as they can about what the substance was, where it came from, who was the last person to see the individual, so that it'll help us develop an investigative strategy. But first and foremost, you know, we brought this out a few weeks or months ago, and it's kind of like our amnesty program. We're not looking to put somebody in jail just because they happen to be there when we get there and there was some drugs on the table or the floor. That's not what we want somebody to leave everything as it was, wait there until first responders arrive.
Thank you so much, Mr. Harrell, for joining us, and great insight.
My pleasure.
It doesn't matter where. The rise in synthetic opioids is leading to more overdoses and deaths on the Suncoast. SNN's Samantha Sonner explains tonight.
Synthetic opioids like fentanyl were developed for people suffering from things like stage 4 cancers and significant pain. Now dealers are selling it on the streets.
Morphine is the kind of the barrier as far as what pain management is measured on, and so fentanyl is about 100 times more potent than morphine, and then we also have carfentanil on scene as well, which is 10,000 times more potent than morphine.
Manatee County Sheriff's Office Special Investigation Division Captain Todd Shear says these dangerous drugs are coming into the country illegally.
We believe it's being made overseas in China, being imported through not only our southern borders but also our northern borders in Canada. We also believe it's being man-made, obviously, in labs in Mexico.
The drugs then follow traditional supply routes.
Sometimes it's being intermixed into the heroin supply, and sometimes it's just being transported over as straight fentanyl.
Shear says it's now the leading cause of overdose death on the Suncoast.
Fentanyl is being sold to addicts as heroin and pain medication, leading to more deaths.
You have folks suffering from the disease of addiction thinking they're going to get a hit of heroin. In fact, it's not heroin. It's a mixture of potentially heroin and fentanyl. A lot of times 100% fentanyl and sometimes 100% carfentanil. So someone who thinks that they can handle this particular dose, in fact, can't handle that dose.
When they arrest dealers, they use all their resources to determine where the supply is coming from. But those routes change frequently.
They're utilizing the same mechanisms that they have for decades. And your guess is as good as mine through airlines, through U.S. mail, through their regular trafficking mechanisms that are already in place as well.
Shear says the Sheriff's Office and other law enforcement agencies can help those struggling with addiction find help before they are mistakenly exposed to fentanyl. Reporting in Manatee County, I'm Samantha Sonner, SNN, the Suncoast News Network.
Code Black Opioids on the Suncoast continues. When we come back, a special guest joins us in studio. She shares an inspiring story of recovery. We'll be right back. By now, you're probably thinking, why do people use these horrible drugs in the first place? Well, I spoke with two local residents who help us answer this difficult question. It's a simple question with a complicated answer. Why do opioids?
People are missing something internally, whether it was from family, whatever it came from, there was something missing, there was a void there.
Tiffani Jigen says she started using opioids in high school.
I thought that drug addicts were people who lived under bridges and were homeless. I was captain of the cheerleading squad when I started using, so I was like, that'll never be me.
She says the fear of withdrawal keeps people using.
What happens is you feel like you cannot get out of bed unless you have a pill.
After going to jail and going through an extensive recovery program, she's drug-free and ready to help others.
Nobody wants to be a slave to the drug.
Terry Rhodes tries every day to figure out why people turn to opioids. He started COPE International, a coalition of organizations looking to prevent opioid abuse and, most importantly, find out why so many people relapse.
From 75 to 91% of the people who go through treatment relapse. And what has worked for this 9%? And that's what we're trying to figure out.
As a recovering addict, Rhodes says it's imperative we lose the opioid stigma.
And we've got to eliminate that to understand that this is someone's daughter, someone's mother, someone's brother.
And it's shocking what our fellow humans are saying. They're saying you make the choice to put the needle in your arm, you make the choice to die. And it's like heartbreaking because it's like, man, thank God nobody said that about me when I was overdosing, because I wouldn't have my children.
Jenkins says addicts don't need pity. They just need love.
There was a time when I couldn't go 4 minutes without using drugs. And I'm getting ready to come up on 5 years. I am proof, and so many other people are proof that there is a better life, and not just a life after drugs, but an amazing life and a wonderful life.
Tiffani joins me now. Now, she runs a blog called Juggling But Jenkins, where your whole thing is to try to let people know that it's okay and to kind of lower that stigma that people have around drug addicts.
Absolutely. I noticed that nobody's really talking about it. And when I first started sharing my story on my blog, I realized that it was the things that I felt most uncomfortable talking about that people responded to. They started sending me messages like, wow, I've never had somebody share so openly. It's giving me the strength to come out and talk about my own issues. And so it just kind of took off from there.
And what was it that kind of made you put yourself out there?
Well, I feel like my addiction was such a huge part of my past and making me who I am today that there was no way that I could not include it in my story about my life.
And what are some of the videos that you do on your blog? I know you do kind of some skits and everything, and it's really funny, but there's a reason why you kind of draw people in with the funny humor.
Right, because I have a more serious message. I use the humor as a way to get through to people, because if you're lecturing somebody about not doing drugs, they won't be as receptive. But if you're being funny about it, then they tend to tune in a little bit more and listen up. I have a video specifically about people leaving hateful comments in the comment section under videos saying that junkie deserves to die, they did it, they can burn for what they're doing to themselves. And it just really hurt, because if somebody would have let me overdose when I was overdosing, I wouldn't have my children, I wouldn't have the wonderful life that I have today. And so I think that what the world needs is more empathy towards addicts instead of so much hatred. I'm not asking anyone to feel sorry for us, but just give a little more love and maybe educate yourself about addiction so that you know how to handle someone who's addicted.
Now, you went through a recovery program, but you were saying the normal, say, 28-day plan is not long enough to fully get off the opioids, and you were saying that's why a lot of people relapse.
In my opinion, I feel like 28 days is just the beginning. 28 days is long enough for the drugs to start getting out of your system, but you have to kind of rewire everything in your brain. If you live for a drug for multiple years, you have to learn how to live without it. And that includes learning about yourself and basic coping skills. And I was in a program for 6 months, and that gave me enough time to kick the drugs, learn who I am, why I do the things I do, and what I need to learn to be a productive member of society.
And how has your life been? 5 years clean come November, right?
Yes, in November I'll have 5 years, and it's like I never thought that I'd be able to go 5 minutes without drugs. And so to have 5 years is a miracle. I've gotten married, I have 3 beautiful children, a home, I pay my bills on time, I go grocery shopping, just normal things that when I was an addict I never thought that I would be able to do. And I'm so glad that I didn't give up when I wanted to, because life is more beautiful today than I could have ever imagined in my wildest dreams.
We'll keep doing what you're doing. I know you're going to change a lot of lives out there, and it's been great getting to know you over the past couple of weeks.
Thank you.
For many people addicted to opioids, they turn to dealers. SNN's Perry Eladerani investigates how some turn to dealers they don't exactly see.
It is much more anonymous in the standard way of purchasing drugs.
As the founder of his own cybersecurity company, Douglas Logan knows a lot about dark web marketplaces and what you can find there.
Fake IDs, fake passports. There are sites that say that they're actually a hitman service.
Among the illegal purchasing options, Logan tells me there's a host of vendors for opioids, all sent to the buyer's home through standard U.S. mail, right under the noses of law enforcement.
That's much more difficult to tell the difference between something that's being mailed to them that's a normal package, or whether it's something that's actually malicious with illicit goods inside of it.
And it doesn't take much tech skill to get to these sites once a virtual currency is bought.
It's something that, my mother or my grandmother could figure out how to do with a little bit of Googling.
Then, Logan says, accessing the market is only a matter of time.
It's not any more complicated than purchasing on Amazon.com or any other website.
To test how long it would take for someone with no knowledge, me, to get onto the dark web, we're gonna time it, starting now. After downloading some software, a couple of internet searches, and filling out new account quizzes, I was there. And stop. Less than 9 minutes, and I was in a position to buy fentanyl in bulk with a host of other drugs and sellers to choose from. Logan says sites like this are often taken down.
Once they figure out the owner, they're able to actually do research and close down the site. So your regular police work is effective in this. It does take a lot of time.
And it's that time that's the problem. Alpha Bay, a large dark web marketplace shut down in July, was making sales for 5 years.
I assure you, from year number 1, law enforcement has been trying to figure out who owns that place to shut it down because it has such a significant impact, and yet it still took them 5 years to do.
But Logan says shutting down marketplaces is just a temporary solution.
But the real answer is going to be when the real problem is addressed, associated with what's causing people to seek out these sites. Why is it that the drug problem has gotten so much worse?
A good question that Logan is still trying to answer. In Sarasota, I'm Perry Eliadrani, SNN, the Suncoast News Network.
It's a crisis across the Suncoast, but how long have opioids been a problem? We take a look at not the so long ago beginnings coming up next. The state and local political response to the war on opioids began nearly 10 years ago. SNN's Grant Boxleiter takes us through the war on drugs.
To understand the full scope of the opioid crisis in Florida, it's helpful to recall what was happening on the streets as we started the decade.
We saw a lot of things like OxyContin and various types of oxycodone-related products.
And these prescription drugs flowed to users through doctor shopping, pill mills, and other illegal means.
It's where you had unscrupulous, prescribers kind of flooding the market with a lot of these pills, and very easy to get prescriptions from certain places.
Sarasota Memorial Chief of Medical Operations R. Stephen Taylor remembers those days in the emergency room.
I think for hospitals all around the country, particularly public hospitals, the big thing there was this. It was literally an epidemic, an explosion of overdoses.
State and local governments responded by attacking the supply of prescription opioids. Zach Anderson covers the legislative session for the Herald Tribune.
And you saw a big effort statewide to try and crack down on some of these pill mills. A huge concerted effort from the state, local on down to try and rein these in, and they were successful in cutting off a lot of the worst actors.
The state approved a prescription drug database in 2012 and made it illegal to prescribe opioids directly from pain management clinics,
which really put a damper on those physicians who were outliers, who were prescribing mass quantities of oxycodone for these patients.
But as the supply of prescription pills dropped, along with overdoses,
the crackdown 7-8 years ago was a move in, I believe, the right direction, but at the same time it might have had some unintended consequences.
The opioid crisis was emerging on the streets in a new form.
The prescription supply went away, but the demand didn't go away. And what you've really seen is a lot of people turn to street drugs and to getting their drugs, in more illicit means.
It started with a flood of heroin and then a dangerous synthetic opioid, fentanyl. Frank Alcock is a New College political science professor.
And then fast forward a few years later, we introduced now fentanyl into sort of the heroin family, and that's where you have, boom.
State and local governments are now fighting a new battle against opioids.
They keep addressing the supply. One thing that they haven't done a great job is addressing the demand and trying to help the addicts and get fewer people addicted to these drugs.
Reporting in Sarasota, Grant Boxleitner, SNN Suncoast News Network.
The point of view switches when we come back from those suffering addiction to the ones interacting with the users. Code Black continues in just a moment, so don't go away. to inspiring stories of recovering addicts, but what about the stories from the people who deal with them when they're addicted? SNN's Nicole Samavilla now has a closer look at how first responders and ER personnel deal with the epidemic.
As the opioid epidemic worsens, Sarasota ERs and paramedics are on high alert and stocking up on the reversal agent Narcan.
For basically the first half of 2017, we've already had 660 calls where we used Narcan.
Compared to 893 calls for all of 2016. Assistant Chief of Administration for Sarasota County Fire Department Rod Van Orstel says on average they administer Narcan 3 times a day, which means they're constantly refilling their supply.
Each truck carries, I think, 2 in their kit that they carry actually to the patient's side, and then in the truck itself we usually carry probably 4 more.
Pumping the perfect amount of Narcan in hopes the patient will make it to the ER. And for emergency medicine physician Stephen Combe, this scene plays out on a daily basis at Sarasota Memorial Hospital.
10, 20 or more various overdoses of different types of medication that come in through the doors here every week.
Each one lucky if they survive.
We don't know if this is going to wear off in a half an hour or an hour, and then they're going to go back into their coma again. That's why we need to watch them for a while after we give the medicine, if it does work.
And the patients aren't the only ones in danger.
We've had nurses get punched. We've had techs get kicked. Sometimes some of these patients will try and bite you or scratch you.
But Combe says it comes with the job, and there's a bigger picture.
I've been doing this for a long time, and this is probably one of the 3 biggest issues I've ever seen. So many young people are losing their lives, more so than from car accidents. So that says a lot right there.
What may be the most alarming.
What we're doing now is, I think, sticking a finger in the dike. We either need more programs, we need to cut back on the supply of drugs, but we're losing an awful lot of young people, and it's a real sad tragedy, and it's just truly a national emergency that needs to be addressed.
Caitlin Perez joins me now. She's a PIO with the Sarasota County Sheriff's Office. Now, you're making sure your deputies are equipped every day when they go out to handle these overdose calls.
We are, and we've been very fortunate to receive a grant of naloxone auto-injectors. Sheriff Knight saw this on the horizon several years ago. October 2015 is when we received these auto-injectors, and basically what they are, it's a 1-dose shot of naloxone, which will reverse the side effects of an opioid overdose in real time. So I'm going to show you how it works. And this is just a trainer, so it's going to explain to you what to do, but the real thing talks to you just like this does, so you really can't mess it up.
Nice.
This trainer contains no needle or drug. If you are ready to use, pull off red safety guard. To inject, place black end against outer thigh, then press firmly and hold in place for 5 seconds. 5, 4, 3, 2, 1. Injection complete.
So that's really the life. Oh, it's not over. Is it over now?
That's it.
Okay.
That's it. Yes.
So it talks to you, and this is the life-saving devices that really can reverse those overdoses.
That's right. And so we got them in October 2015. The first time we actually deployed one was in January 2016. Since then, we've deployed naloxone 114 times. 8 times have been unsuccessful. So that's about an 86% success rate. And it's important to mention that those 8 individuals who passed away, those were due to extenuating circumstances, like the individuals at the home didn't call 911 quickly enough. So this is just another tool on our tool belt, for my deputies to get there as soon as they can and get to work before EMS can respond.
And something else on the tool belt is a 4-prong approach, which really focuses a lot on education, right?
It does. Sheriff Knight has kind of branded this 4-pronged approach. He's a leader in the community and really a pioneer. He saw this coming, like I said, on the horizon several years ago. So the first component is enforcement. First and foremost, we're a public safety entity and we're law enforcement. So we're looking for the dealers, the traffickers, and we're going to hold them accountable. Just recently, the sheriff, made a public statement about an individual that we arrested and charged with murder. That's a big deal, and the reason why is we could connect that individual with providing carfentanil to someone who overdosed and died. It's big stuff. You know, these individuals are out there dealing stuff that is so deadly, they have to be held accountable. So that's that first component of enforcement. Then we move into education, and we talk about prevention and preventing the next victim. Naloxone is an example of how we're preventing the next victim. PSAs, social media, etc. Always, you know, talking to the public about what they need to do. One thing we really want to make sure people understand is in that moment when someone is overdosing, you need to recognize the signs and call 911 right away. In that moment, it doesn't matter where the drugs came from. It doesn't matter who sold them to you. We're not worried about that. We're worried about saving lives, right? Because we're public safety. And then finally, our last component of the four-pronged approach is treatment, and that's something we're very proud of. Back in 2009, Sheriff Knight created addiction recovery pods inside the Sarasota County Jail. They house 48 men and 48 women, so at any given time, there's 96 inmates in the Sarasota County Jail receiving treatment, going through rehabilitation, and trying to cope with the battle of addiction. To that end, we also employ a program called Vivitrol, which is another kind of opioid dependency drug where inmates can take part in this program and receive shots while they're incarcerated to help them battle that addiction. So it's this you know, really well-rounded, pragmatic approach that Sheriff Knight has taken on. And he said time and time again, this isn't a problem we're going to arrest our way out of. Right? There's more to it. So that's where we talk about education, prevention, and treatment. We're doing our best, but we definitely need the community's help to put an end to this.
Let's go back to that murder charge. Do you think that strong message to these dealers that you're not just being a drug dealer charged with possession, you were being charged with murder? Do you think that strong rhetoric will help slow down the drug dealers here in Sarasota County?
You know, we sure hope that it will. You know, unfortunately, and we talk about this often, we don't know what's causing this. If we knew, you and I wouldn't be having this conversation right now. What we do know is these individuals are coming into our community and they're dealing these synthetic opioid derivatives. So it's not just heroin anymore. We're talking fentanyl, carfentanil, things that are 10,000 times more potent than morphine. I mean, this stuff will kill people instantly. So we hope that the dealers understand that it's not going to be tolerated in our community.
And you've grown up around this area to see how far it's gotten and how many people are overdosing in your home community. Does that just break your heart, not only for being a law enforcement, but just as a person?
It does. It's heart-wrenching, and certainly for our deputies, it's important, you know, for everyone to remember our deputies are parents, our deputies are husbands and wives, and oftentimes we have these young deputies who are 23, 24 years old, straight out of the academy, and they're going to multiple overdose calls every shift. You have to think about kind of the impact that has on their mental health and on their mental wellness. So it's something that we talk about a lot, you know, at the office, make sure everyone's in good health. That is a priority for Sheriff Knight and for our agency. The challenging thing here is, though, we don't know what the answer is. Like I said, there's this kind of gap in treatment. What's the next step? Unfortunately, the demographic isn't clear. The youngest patient we've had to respond to for an overdose has been 18. The oldest has been 73. There's no middle ground. We can't seem to figure out, you know, what demographic we're working with. We do know that 70% of the patients that we've dealt with have been men. So we are seeing more men, but of course that's just locally. That's just here in Sarasota County. That doesn't count the other jurisdictions and nationwide what's happening. We're just doing the best that we can with the tools that we have.
It sure does affect all of us. Thank you so much, Caitlin, for joining us tonight. Deputies often run into dealers trafficking these dangerous substances. What they may not know is they could be charged with murder. SNN Samantha Sonner has these details.
When it comes to fentanyl and carfentanil dealers, Sarasota County Sheriff Tom Knight has a message.
Is that if individuals, the dealers, the traffickers are going to find it necessary to deal this poison, it's like playing Russian roulette with a gun. And if they're going to pull the trigger and the gun goes off, we're going to charge them with murder.
Knight says they are investigating opioid overdoses as homicides.
It's important to prove, one, that that substance is what created and caused the death, and that we are able to, through investigative means, track back that this individual who's being charged was the one who dealt it to that person.
Manatee County Sheriff's Office Captain Todd Shear says many times those suffering from addiction are unaware they're being sold the stronger fentanyl and carfentanil.
A lot of times 100% fentanyl and sometimes 100% carfentanil. So someone who thinks that they can handle this particular dose, in fact, can't handle that dose. It's much more lethal to them and they end up passing.
Sheriff Knight says dealers know how dangerous these drugs are.
Knows that it has that potential to kill people, just like a gun will kill people. They know it. It's in their hands, just like a gun's in their hands. When they deliver it and it causes a death, we're going to charge them with murder.
Captain Cheer says come October 1st, prosecuting dealers will be easier.
House Bill 477 is going to change some things for us, and by making fentanyl and carfentanil one of those substances that we can charge somebody with murder with. And we'll continue to look at every case, every overdose case, as if it was a homicide.
Florida Senator Greg Steube was one of the lawmakers to introduce the bill to help get these drugs off the streets.
If we can put the dealers behind bars and put them behind bars for a long time, then maybe that'll solve the problem with all these people getting their hands on these drugs.
Knight says putting them away might make other dealers think twice.
The dealers are more aware of what's going on. They're just finding a way to make a profit. They don't care about the addicts. They don't care if it kills people. So the message to the dealers and the traffickers is simply put in Sarasota County, if you deal it, you traffic it, it gets used and causes a death, we're going to charge you with murder.
Reporting in Sarasota, I'm Samantha Sonner, SNN, the Suncoast News Network.
With so many reports of overdoses, opioids, and drugs on the Suncoast, it's almost comforting to know we're not alone. We are not the only ones dealing with this problem, and we'll look more into this coming up.
Is an emergency, and I'm saying officially right now it is an emergency. It's a national emergency. We're going to spend a lot of time, a lot of effort, and a lot of money on the opioid crisis.
President Trump declaring last Thursday the opioid crisis a national emergency. Trump's Commission on Combating Drug Addiction and the Opioid Crisis says drug overdoses now kill more people than gun homicides and car crashes combined. The New York Times calls drug overdoses the leading cause of death among Americans under the age of 50. About 65,000 died from overdoses in the U.S. in 2016, most of them linked to opioids. Florida is actually the #2 state in the country hit hardest, according to the New York Times. These are the numbers of overdose-related deaths compiled in 2015. California with a staggering 4,600 deaths, and Florida's not far behind. Governors in 6 states have already declared an emergency: Alaska, Arizona, Virginia, Maryland, Massachusetts, and Florida. Governor Rick Scott declared the emergency in Florida back in May, but despite that, Florida still isn't tapping Medicaid to help pay for drug treatment. So there's no doubt we're not alone. Here's SNN's Grant Boxleitner.
Opioid abuse around the nation has reached epidemic levels, with states such as Ohio and West Virginia hit especially hard.
This is probably the worst drug situation in our country in decades, if not a century.
In 2015, nearly 92 million Americans used a prescription opioid. More than 11 million reported misusing them, and 2 million admitted they were addicted, with deaths up 4 times higher between 1999 and 2015. The study shows those most likely to misuse opioids include people with low incomes, the unemployed, and underinsured.
There are people at risk for not having full access to health care, so we think that's part of a clue here.
The research also finds that almost half of those who misuse opioids get them from family and friends. In one of the hardest hit areas, the state of Ohio, Attorney General Jeff Sessions unveiled a new program aimed at reducing drug overdoses. The Opioid Fraud and Abuse Detection Unit will track down physicians and healthcare providers that illegally prescribe painkillers.
We cannot capitulate intellectually or morally to this kind of rampant drug abuse. We must create a culture that is hostile to drug abuse.
To fight an epidemic that is stretching from coast to coast.
In the face of the worst drug crisis in our history, we need to use every lawful tool we have, and we will. But I'm convinced that this prescription drug abuse effort is a winnable war.
Grant Boxleitner, SNN, the Suncoast News Network.
With so much darkness, there is light at the end of the tunnel. When we come back, we'll find out how users can get help. We'll see you then. can lead to deaths and overdoses, but what other complications can arise? SNN's Hallie Pilot has this story.
It's a really bad idea to use heroin. It's a much worse idea to use heroin in such a way that you can get addicted to it, but it is by far the worst idea to die from being someone who used heroin.
Deaths and overdoses from heroin, just a small part of the big picture.
But we also have the deaths that are connected to it. And HIV, as you mentioned, probably one of the most poignant.
Florida is the #1 state for new cases of HIV and AIDS transmission.
It's time to have a dialogue about what we're going to do about this.
The main catalyst to the problem, needle sharing.
One of the things that we consistently are asking is, are you sharing needles?
He said about 50% of the time, that answer is yes.
Once in a while we'll hear someone that might have picked up a needle in a park.
Not making sure that a needle that they're going to use to get high is safe.
Piper said we now need to look at harm reduction.
One way you stay alive is you do things like needle exchange programs.
But these programs are controversial.
It's been a fight almost for the last 5 years to get this program approved through the state legislature.
The Florida legislature didn't want a needle exchange program to be funded through public dollars.
Because to them, they felt that it was promoting the use of drugs.
But do you want them to get AIDS just because they chose to do heroin?
Piper said these programs don't promote the use of drugs.
They make sense in that at least you don't spread those diseases further.
Because addicts are going to do the drugs, whether they have clean needles or not.
Individuals that have addiction, they're going to find a way to do and continue their addiction.
And no one knows better than Johnny Calloway.
Well, I was a drug addict for 20 years.
He couldn't afford opioids, so he made his own drugs.
I don't know why I never shared a needle, I just wouldn't do it.
But he had a lot of friends who did.
Had a lot of friends die to the needles and swapped them and ended up with HIV, and some of them ended up with Hep C.
Something he couldn't really process at that time.
You have a way of being so focused on getting more drugs that you kind of detach yourself from the pain of loss.
They're in the underworld of our society. They're running to get their drug. They're trying to stay high.
Calloway is grateful to be alive, but others aren't always as lucky.
I have no idea why I'm still here, because with what I was doing, I shouldn't be.
I love my clients. Yeah, let's keep them healthy. Let's save their lives.
In Sarasota, Hallie Pilot, SNN, the Suncoast News Network.
And I'm so honored to have John Acevedo and Robert Piper here in studio with me. It's a very controversial topic, this needle sharing, but it's something you feel very passionate about, that it should be in place.
Correct. It should be in place because it assists us in stopping the continuing spread of HIV.
So kind of explain to me, we all know we shoot up heroin with needles, and that's when you guys come into place with CAN preventing HIV. You don't want these drug addicts out on the street using dirty needles that they find in an alley or that someone just gives them that they don't know. It's a real risk.
It is. Individuals, like you just noted, that they'll find a needle, and if they don't have any clean needles, they'll go ahead and use drugs with infected needles, and next thing you know, we're seeing them in our clinic and we're diagnosing them with HIV. And that's something that we want to try to prevent so that we stop the continuous spread of HIV within our community.
And how many people are coming in your clinic, let's say on a weekly basis, asking that have this needle sharing problem?
Well, we see a handful, but we know there are a lot of them out there. Hence why we like to at times partner with our partners over at First Step in making sure that those individuals that we see at our clinic, we refer them over to First Step to receive additional services.
So it's one continuous chain. They come to you and you obviously help them with the HIV aspect, but then to get clean, that's when you come in, Mr. Robert, at First Step. What are some of the things that you're doing here locally to kind of end this epidemic?
Well, there's a lot going on, and there's a lot more going to be going on. But basically, we do everything from the detoxification, which is the first step to get you safe and in a place where we can hopefully motivate you to literally save yourself. So then we have treatment programs all around Sarasota, South County, North County. We have residential centers. We have a special program for the homeless in the Salvation Army. So we're doing a lot to reach out to provide treatment for the people who suffer from addictive disorders. But there's also some things going on behind the scene where the Sarasota County Health and Human Services and the Sarasota Sheriff's Office and Operation PAR and First Step are looking at ways to pick people up as they're leaving the ERs. And wrapping some services, including peer mentors around them and case managers, and follow them some time out of the hospital so we can target the population that seems to be the most at risk for dying here. People are scrambling fast. Hopefully there's going to be new dollars. We need new dollars. Historically, only 1 in 10 people who need appropriate treatment for addiction disorders have been able to receive it. So it's in crisis mode, and everybody's working together, shoulder to shoulder. Wonderful community. Law enforcement, treatment, ancillary services, all working together, shoulder to shoulder, one goal, save lives.
So there are tons of resources here for people who are still addicted to reach out and get the help they need?
There's a lot of resources. We're a blessed community. Most communities, you have gaps that people fall through and they just splat. We're one of the only communities where the Sarasota County government actually funds a residential treatment program, which we provide the treatment for, Salvation Army provides the home for, and there are other agencies that get involved and provide services too. And this is for the people that have no money, no insurance, and no other way to access treatment. So in Sarasota County, there's something for everyone, and that's an unusual community.
When CAN first opened here in Sarasota, did you ever expect that there would be such an epidemic with opioids here locally and people will be coming through your doors seeking for help?
Not at all. You know, we don't wake up in the morning thinking that a lot of these conditions, a lot of these situations are going to be happening in our community. But you know, the thing is that we make sure that we're providing the services that our community needs. You know, whether it is HIV, hepatitis C testing, as well as treatment, and also STDs. You know, we're out there making sure that every client that comes through our door receives the services that they need, as well as they're getting referred to the other services that are going to assist them in breaking the habit, as well as getting the treatment that they need within our communities.
I mean, you guys have been around for years now, so I guess you've kind of had to adapt and kind of change with the times as it became more prevalent that people were coming to CAN for this opioid issue.
Oh yeah, we're seeing not only HIV, now we're seeing lots of clients that are coming in with Hep C. You know, our testing program, a Hep C testing program, we're seeing them. You know, just 2 weeks ago, we had an individual that was tested for Hep C and was diagnosed with a new case of Hep C. So now we make sure that we provide them with the treatments, and then if they have some type of substance abuse, we refer them on to additional services.
And what is the first step when people say they're watching this at home right now and they know a family member who's not watching but has a problem? Do they just call first? Is it an open door policy? They can walk into your office? What's the deal, or initially the first step?
Well, specifically for addiction through First Step, they could call. It's 941-366-5333 and access a variety of our services. We also have a great website. FSOS.org or firststepofsarasota.org if you want to spell it out the long way. That has a portal into our detox center which will let you know whether a bed is available or not and how to access those beginning medical oriented services. And a very good website that will take you around where you need to click call to find and access the treatment that you need. You know, I think that what we're seeing is a whole bunch of people in this community working together from the same perspective. That is kind of a shift. At least I feel a shift. That it's not so much anymore that people who suffer from addictive disorders are bad people, weak-willed people that we need to punish until they you know, get smart enough to not do these things anymore. To really accepting the science of the last few years of a brain-based disease model of people whose brains literally get hijacked. And now, you know what? Brains are getting hijacked at every level in our society. Heroin is no longer an underculture phenomena, if you will. So I think it's the right time for our country to take a good look at drug policy and see if we can find something that we can be bipartisan about, that this is really not about punishment, it's about saving lives. Right. And we're an enlightened community that I believe is ready to turn that corner if we haven't already turned it.
Well, we're definitely all in this together, guys. Thanks for joining us. And don't go away, we'll be right back. Welcome back. I'm joined again with John Acevedo from CAN and Robert Piper from First Step. We talked a lot about the partnerships that you guys have formed, but if you had to add one more thing that we haven't touched on, what would it be tonight?
For me, I would have to say with HIV, STD, and Hep C, one of the things that our clients tend to see within our community is stigma. One of the things, and these individuals are stopping from coming in and getting treatments or even accessing services. We have to be mindful that we all have feelings, and someone might be going through some issue, that we have to embrace them within our community and make sure that we don't stigmatize what they're going through, so that we can continue finding more individuals like that, so that we can provide the necessary services to them.
Thanks, guys, again so much for joining us here tonight, and thank you so much for joining us for our special report, Code Black, Opioids on the Suncoast. You can find additional reports and more on our website. That's snntv.com/opioids. I'm Lyndon Blake for SNN. Good night.
Code Black, Opioids on the Suncoast is brought to you by CAN, Community AIDS Network.